All right, 722 now. We've been talking about this all week. Funding for federal food assistance through SNAP, that's expected to expire tomorrow. That means almost 930,000 people here in our state, in Washington, may face food insecurity. But that's not the only issue Americans will have to deal with starting tomorrow. And Alex Jacquez, Chief of Policy and Advocacy at Groundwork Collaborative, joins us now this morning to talk about all this. Good morning to you, Alex. You know, open enrollment begins tomorrow, but some families are going to be shocked at just how much more expensive health care will be starting next month. So what are the average premiums, the increases that we can expect here?
That's right. So the average family is going to see a doubling of their annual premiums if they use the expanded tax credits that are expiring at the end of the year. So that's going to mean an increase of over $1,100 on average. But where it gets really tricky is in the specific cases. So of course, by state, by income bracket, and by age, the premiums are going to wildly differ, and some people are going to get hit with much larger bills than they're expecting. So in Washington, the state ACA enrollment exchange is anticipating that on average, they're going to see 65% premium increases. You can do some what's called window shopping on the website before it opens up tomorrow. But if you look at a couple of these test cases, you look at a 45-year-old making $64,000 a year who's on the exchanges, they're going to see a $9,000 annual increase. A family of four making $130,000 a year, $12,000, and a 6-year-old couple making $85,000 a year, $48,000 a year.
Wow.
And so at prices like that, the anticipation is that these families won't pay the premiums, they'll simply go without health care.
Those are huge increases here. So what led to all of this, these sudden increases?
So about 24 million people are on the Affordable Care Act exchanges, and about 22 million of those people get help affording their premiums through what are called premium tax credits. In the tax bill that Republicans passed in July, they did not extend the premium tax credits, the enhanced premium tax credits that Democrats had passed over the last few years, and those are set to expire in December. And right now, if you look across the board, medical prices are going up. Health insurance outside of the marketplace is going up. People are seeing an increase in premiums. Health inflation is growing faster than overall inflation, and it's doubled the pace of the last 2 years. So not only are premiums going up in general, but now these families are not going to be able to rely on these tax credits to help them afford their monthly premiums.
Yeah, some scary stuff here. So the all-important question is, how can people save money on their health care right now?
I think that's just the hardest part about this. Healthcare isn't something that you can really bargain shop on. When you get sick, when you need to see a doctor, when you need to have a procedure, you simply need to be able to go. And that's what insurance is supposed to be there for. That's why we need to make insurance affordable. And right now, Republicans in Congress can sit down with Democrats and negotiate to, one, help end the government shutdown, but two, try to lower those healthcare costs on top of all the other costs that people are really struggling with.
Yeah, speaking of that, what is the ripple effect of this and then the loss of SNAP benefits as well right now?
So right now, the Supplemental Nutrition Assistance Program is currently not going to be sending out money in November. This is a program that 40 million people rely on to meet their nutritional needs day to day. There's about, as mentioned, over 900,000 people in Washington. That's about 1 in 9 people who, starting tomorrow because of the government shutdown, will not be able to get those benefits. That generally is about $180 a day, or $180 a month in Washington, comes out to about $6 a day. It might not sound like a lot, but it keeps millions of people, including millions of children, out of poverty. So right now, while there is a court decision pending on whether the Trump administration will have to tap a reserve fund to pay out some of this funding, Washington is mobilized to send about $2.2 million per week to food banks to help support those who are not going to get enough to eat. But hopefully we get a resolution and get those contingency funds out the door as soon as possible.
All right, a lot of people are going to need a lot of help. Alex with Groundwork Collaborative, thanks for being with us this morning.